This is Dr. Oswal from Pune, India, at the Center for Life Sciences, Health and Medicine, and we are doing remarkable work with neurological disorders to help children with disability on the level of humanity and at the scientific platform. I am very happy to share with you that we are honored with the guest Dr. Christoph Garner from Germany. He was the director of neurological big hospital in Germany, Bad Griesbach and Munich, and he is visiting us here for last almost 10-12 years. Every year he is coming to observe our work, and he is with us to develop some new scientific research in different neurological disorders like progressive dementia, then Alzheimer's, and SSPE, subacute sclerosing panencephalitis, with our G therapy or neuro-G medicine. G therapy was developed on the principles of Ayurveda and neurophysiology, and it was based on the Sukshma Chikitsa principles, and it is in the homeopathic form, sweet pills. It is very interesting that about 3000 years back, Charak and Sushruta, they have described entities very similar to genetic transmission of the disease in the children and developmental disabilities. And they have also suggested the basic principles of how the drugs they act in human body. And the plants have no religion. No plant will say that I am from conventional medicine, or I am from Ayurveda, or I am from homeopathy. It is how you use that, how safely you use that. And I would like to give you some references from the text of about 3000 years back, Charaka and Sushruta. They have described in Ayurveda. One of them was Nasti Dravyam Anaushadham. That means Ayurveda says that there is not even a single substance in this universe which has no medicinal property. So all substances in the universe have medicinal properties. The other one is that संस्कारो हि गुणांतरधानम उच्यते संस्कारः करणम मतम करणम गुणांतरात्कतुम संस्करणम इत्यर्थम. Due to sanskara, medicinal properties, that is guna, can be increased or decreased. Sometimes it can also alter the site of action of these substances inside the body. For example, a substance, when it is mixed with, for example, tulsi, when it is mixed with honey, it will have a different action at different level. And when it is mixed with some other substance, it will have a different action in different channels of the body. Similarly, the Bhava Prakash or Sushruta, they describe Yasya Vivarane Shakti Sa Sukshmaha Sukshmastu Sukshmyam Sukshmeshu Stotraha Svanu Saraha Smrutaha Dehasya Sukshma Chidreshu Visheshya Dat Sukshma Muchyate. That is, a medicine is called Sukshma when it goes deep inside the body, or it is because of its finest size, it enters the smallest stotrasas. So stotrasas are like neuronal cells, or in between the neurons there are some synapses. So a substance can enter the synapses also when it becomes so small, so minute, that is a nanoparticle. The modern medicine or the modern science has described the concept of nanoparticle, which was described in Ayurveda about 3000-4000 years back. That when the substance becomes small, it comes to the molecular level, or below the molecule also it can go. And Ayurveda described the different methods to make the substance small in smallest particle. Thereby, it has got no side effects because it is going in the body in the smallest particle, smallest size, small minute quantities, and it can directly go into the strota. That means it can directly go even up to the level of synapses, and it can act. So there are so many different references given in the Charak and Sushruta, and I have described all this in my Mind Body G booklet, which was published in 1999. now we are working on a very different progressive lethal neurological condition called subacute sclerosing panencephalitis, and here we have documented for the first time that EEG in a progressive neurological disease can become normal or it can come to normalcy, and the patients or the children are improving clinically. We have recently published our data in a prestigious neurological conference, International Child Neurology Congress, which was held in 2018 in Mumbai, and I presented this work on platform presentation, and we are doing this work totally free. Me and my daughter, Dr. Pooja Upasni, we are doing this work totally free. We have about 520 patients of subacute sclerosing panencephalitis which are treated here, and I am going to publish a new booklet with almost 100 patients before and after treatment with their EEG graphs, how the EEG has improved before and after treatment. So I would like to Dr. Gardner to speak something his experience on our work, and what he wants to intend for the future research. Thank you very much.
Dr. Oswal, thank you very much for being here. My name is Dr. Garner. I'm a neurologist, and I met you first in 2005, I think, and have been very much impressed by the results you have achieved with children with different neurological diseases. And for some years, or I can say for many years now, I am coming regularly to discuss with you the opportunities, but how gene therapy can help these children. Now today I am here to start another project because our clinic and our institution has a big amount of patients and people with Alzheimer's disease, where we have only very limited possibilities to help them, except to calm them down, and but not really helping them. And since I found that you have so much great success with SSPE children, which is a neurological disease which normally untreated leads in our Western countries inevitably within a couple of years to death. And to my surprise, I found here these people who not only survive, but which who get very good life quality again. And because Alzheimer's is also a process where the brain gets destroyed slowly until the personality completely subsides, and the end is the same with how it is with these children, that they are lying there, no contact, nothing being able to do. We had the idea to test whether gene therapy can help these Alzheimer patients. Thanks to you, we can plan a double-blind study in our institutions with Alzheimer patients to see whether this type of homeopathy is able to stabilize the disease, or even if I see the SSPE children, which are also improving, maybe also helping to improve the life quality of these poor patients. And this would be a very big improvement, and I'm very happy that we can start this next year. Thank you.
Thank you. God bless you.
Yeah, thank you.